Okay, I'm going to talk about the problematic of, I'm sorry. Yeah, I'm going to talk about the problematic of aging women living with HIV in the Democratic of Congo. So, first of all, we got some of them. They are over 60 and 70. Especially one, she's 75 years old, and she has been living with HIV since 1983, exactly the year I was born. So it means that she's now living with HIV for about 40 years old. Aline Disasho Congo. We are working together. Even the abstract was written with her. We were supposed to come with her. She was the one who was supposed to present these case studies, but unfortunately she couldn't travel with her, so she didn't come. Okay, so the HIV/AIDS contribute a public health threat. So women are the most affected, and 90% of them are affected through through sexual contact. So women represent more than 60% of people living with HIV in the Democratic Republic of Congo. But why? There are some reasons. Apart of their vulnerability due to the social, economic, cultural, and biological factors, HIV-positive women also face the challenge of aging. So the care of HIV-positive women has been very successful in the last 10 years. With the continuous improvement in the combination of ARVs. However, despite these efforts, the health system still has significant limitation, especially regarding the care and quality of morbidities due to the aging in the female. Nearly 25% of women living with HIV on ARV treatment are over 50 years old. In addition, the identification of HIV-positive women, as well as their biological monitoring due to comorbidities linked to advancing age, remain a great challenge due to the weak institutional response in my country. No, this one. Oh, perfect. Oh, good. Okay, so this is exactly what I said before. So I'm going to talk about the Democratic Republic of Congo with less than 25% of women living with HIV who are over 50 years old, according to the software. And also that the multi-comorbidities with those who are beyond the age of 55, they are facing more, 50% of them are facing, they are having 2 or more comorbidities. And those who are over 65 years, 70 or 80% of them they are having or they have 2 or 3 comorbidities. So what was the main objective? It was just to contribute to the elimination of HIV by 2030. I was surprised to hear that Kenya is working to have this the elimination of HIV by 2027. That's impressive. While my country is waiting for 2023. So, but there are some specific objectives of this study, such as to identify bottlenecks in monitoring elderly women, and also to propose some corrective strategies. Well, what were the methods we used? We used what we called a qualitative studies that requires to talk to them, to go through the women living with HIV in the 30 age. So the study was carried out in 9 different provinces in the Republic of Congo. And that study provided us with information on HIV-positive women aged between 50 and 75 years by proceeding as fellows. Well, identification of a diverse sample of participants, those who participated to the study, who met the criteria such as gender, socio-economic status, the different health care settings, and support. We also collect the data through individuals interview or group discussions, and to collect personal stories, experience, opinions, and perceptions, but as well as observation techniques. Then we were supposed to analyze and describe the data collected to identify the recurring themes, patterns, and the unique perspective. Oh. Well, the method was also to interpret and report the result of our analysis and to present using the appropriate qualitative method, such as thematics, analysis, or narrative description. Also, prioritizing ethical consideration, such as obtaining informed consent, ensuring the participant the confidentiality, and involving local stakeholders and or any organization familiar with the HIV in the study design process. This method was really effective because we are in countries where people are very, they believe so much. Some of them can say, this is forbidden by my church, or this is forbidden by my custom, and so forth. So we focused on the method number 5, and that works very well. Okay, so what was the result of the study? In all, the old women living with HIV in the 9 provinces included in this study, the majority of them have access to good health care and support. The numbers will come after. And also, but on the other hand, a good number of them are still victims of stigma and discrimination. This is normal. I think this happens everywhere in the world. And those stigma and discrimination leading them to the deterioration of the quality of their life, and also the well-being, even their loss. Furthermore, only a few of these women are unknown. They are not even in any database. They even go to any facilities to take to be screened, to be checked up. Nothing. They are really unknown, and they are still living hiding. Nobody know about them, about their HIV status. They are just living. So we don't know whether they are going somewhere or to be treated. So here are some provinces where the study were carried out. The name of the provinces are in Kinshasa tongue, so you will probably not understand, but you can see some provinces have the higher prevalence, some of them the lower, and the grand total is there in the other side. So here are some challenges, such as the HR quality, also some of the health system financing, the health system resilience, but we also have to mention that the geographical coverage. Some provinces in the DRC, we don't have access, and even themselves, women living with HIV, they don't have access because of the war, maybe the rebellion, such as in South Kivu, in North Kivu. So the geographical coverage was another challenge. Here are some results. Thanks to the early initiative and what we do, some like with ARV therapy using the test-treat approach, and that was very significant, the reduction of occurrence and opportunities infection, thus making the infection like any other disease, chronic disease. Also, the diagnosis and treatment of non-communicable pathologies, particularly those linked to metabolic and neoplastic disorder, such as cancer, cervical cancer, constitute a great challenge in the Democratic Republic of Congo. Thus, efforts to address the impact of HIV in all the women living in Congo include increased access to HIV testing, treatment, and support service. In addition, community organization and health care providers must get involved to fight against the stigma and discrimination, to raise awareness and provide approach care to all the women living with HIV. Here are some conclusions, such as by 2030, more than the half of women living with HIV aging, including 30% of them will be over 50 years old in my country. And also the long term of ARV as well as aging brings a challenge in the management of people living with HIV, mostly women particularly. The management of numerous comorbidities, management of the authorization of ARVs, drugs, the management of drug interaction, the system response that poses a major challenge. So the study was carried out by CALFE and also the national program through the Ministry of Health and the civil society alliance or civil society organizations that are working in the response of HIV, and the two other organizations, RCP Plus and LP Plus. Thank you very much.
Thank you very much.